Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you with us. Also very happy to be joined by the Mayor of the City of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Well, welcome to the media in attendance. We already have several questions in the queue, but if you have one that you have not yet submitted, you can do so by clicking on the question mark inside the text bubble here on Microsoft Teams. And when you do submit your question, please indicate your name as well as your media outlet and who your question is for. Finally, a welcome to the audience today who are following along on Rogers Television as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980, CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks, and we will start this afternoon with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. Lately we have been celebrating one milestone after another in our battle against COVID-19, both locally and provincially. Just a few days ago, the Middlesex-London Health Unit announced we had surpassed 500,000 doses of vaccine administered throughout the region. Today, news from the province that more than 51% of all adults in Ontario have received 2 shots, with 5 million more doses arriving this month alone. It's no coincidence that as vaccine uptake has increased, case counts, hospitalizations, and deaths have decreased. If you're among the 1 in 5 who've yet to get your first shot, or if you're still waiting to rebook your second shot, I'd like you to consider this. As Dr. Mackie mentioned just a few days ago, the health unit recently tracked all COVID cases in London Middlesex between mid-June and the first parts of July. During that time, and in all cases, 92% of COVID cases were among people who were not vaccinated, and 8% were among people who only had 1 dose. None, and I say again, none, involved people who were fully vaccinated. So I want to emphasize again, not a single case involved people who had had 2 shots. That isn't just a local phenomenon, it's a similar story across Ontario and with an even larger sample size. Between mid-December and the end of June, there were over 400,000 cases of COVID in our province. 96% of those cases involved people who are not vaccinated. 3.9% were from individuals with 1 dose, and less than 0.5% involved those with 2 shots. So I have to ask the obvious question. If you haven't even had your first shot, what are you thinking? What are you waiting for? The evidence is overwhelming and the protection provided by these vaccines is extraordinary. We're blessed to live in a region and in a country where we have ample access and supply. What we need now is for everyone to get their shots, their first shot and their second shot, and do so as fast as possible. Now, if you've already been double dosed, your job isn't over. Tell your family, tell your friends, tell your coworkers how easy it is. Tell them how well our vaccination clinics are run and how good it feels to know you've protected yourself and your loved ones. I recall walking out with my second shot just a couple of Saturdays ago thinking, this gives me a lot of confidence. This feels pretty good. My wife felt the same, and I know many who feel the same, because it is our obligation as a community. Protect our families, protect each other. It's our shot to end the pandemic once and for all. So let's not miss this shot. Instead, get the shot. Book it today at covidvaccinelm.ca. So that's it from me. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor, and thanks for pointing out all of those great milestones being achieved. There's one other milestone that I'd like to mention today, and that's around catching up to the provincial vaccine campaign. As you know, the region has been behind because appropriately vaccines were allocated to hotspots early in the vaccine campaign. Now, if you look at everyone aged 12 and above, the provincial campaign currently stands at 77.3% of everyone aged 12 and above that are vaccinated. Locally, we're at 77.4%. So 0.1% higher in terms of first doses for everyone aged 12 and above. So we've now officially fully caught up to the provincial average for everyone aged 12 and above for first doses. We are behind when it comes to second doses. Provincially, we're at about 50% second doses. Locally, we're around 39% as of Friday and climbing, of course. So that's really where we are focusing the campaign as well, continuing to offer additional options for first doses. But the second dose vaccine campaign is really accelerating right now, and it's where we will certainly be putting a lot of our efforts over the next little while. Another milestone, we cracked above 7,000 doses given in one day this week. That was on Wednesday. We were able to give over 7,000 doses in one day just across the health unit and partner clinics. And the vaccine campaign in pharmacies, once again, would be on top of that number. So the vaccine campaign continues to be in very good form. From a case count perspective, we've seen single digits for several days now. Fortunately, no deaths as well. So things are petering along there. We aren't seeing further decline really for the last 2 weeks or so. Rates in this area have been fairly flat, but they're flat at a low and manageable level. And hopefully that continues on without climbing back up again. I want to mention something that came from the province as well recently, because it ties into a priority that the health unit has identified, and also that has become very evident through the pandemic in terms of important health impacts of the pandemic, aside from the infections themselves, and that's around mental health and addictions. Yesterday, the province announced an investment of an additional $32.7 million across addiction services, including opioid addiction treatment. It's part of the implementation of the Roadmap to Wellness, which is a provincial guidance document around mental health and addictions. Some of the key investments there include expanding RAM clinics, that's rapid access to addiction medicine, which is really about getting people off the street drugs and getting them into stable long-term medical treatment. That will be a huge boost. We have seen rates of opioid addiction and death unfortunately climb significantly during the pandemic. And the provincial investment in mental health, which actually includes mental health promotion as well on the prevention side of things, will be a much needed addition. And then we also had a news release. I know that you're well aware, and we're very involved in that today, really offering a number of additional options for people to get vaccinated. We have a website now which details all of the walk-in pop-up clinics that are being offered. Maybe Dan, you or Beth could plop that link into our web address. Though there will be several pop-up and walk-on clinics available over the next little while. We know that for some people,
for the web page with all of the walk-in pop-up vaccination clinics has been added to the chat. So again, for those of you who don't have access, if you're watching or listening, www.healthunit.com/pop, P-O-P, -up -vaccination-clinics. That is the address that will give you all of the walk-in pop-up COVID-19 vaccination clinics that would be held between now and pretty much the middle of August. Now, do come back to the website, because as those clinics happen, we will be adding more, and even before some of those happen, we'll be adding more clinics as we expand the opportunities for people to get their complete series of COVID vaccine doses. Now, with that in mind, one of the other vaccination clinics that's happening today, a walk-in vaccination clinic, is happening at the Middlesex-London Health Unit at City Plaza. So if you are someone who is looking for something to do on a rainy, sunny summer afternoon, come on down to City Plaza and the southeast corner of Clarence and King. Come on inside and you can get your vaccine, whether it's your first dose or your second dose. Walk-ins are welcome and no appointment is necessary. I feel like I'm reading commercials, but there we go. Let's get to the questions, because we do have a lot. The first, Dr. Mackie, is for you, and it comes from Carrie Mackie at CBC London. Dr. Mackie, it appears that the 29 to 39-year-old age group is falling behind when it comes to getting vaccinated. Do you know why? And what is being done to get more shots into arms for this age group?
Thanks, Carrie. We're definitely watching that closely. We don't have any formal survey data, but some of the reasons that have been considered are around childcare and really a very busy time of life. And we know that this is an age when lots of people are having children, and it can be quite stretched. We know that Middlesex and London are communities that are very family oriented, and that people invest time and energy in their kids. So that could be part of what you were seeing here. We're certainly working with partners that have distribution lists and connections to that age group, looking at our own client lists, how we can get the message out to that group, and doing things like reducing barriers. These pop-up and walk-ins are a great example, and we'll thank you in advance. Carrie, I know that you and others will help to get that pop-up clinic schedule out, so that when those folks do have half an hour free, they can just run over to the clinic and get their shot.
Thank you very much, Dr. Mackie. And I wasn't going to suggest it, but if Carrie is at the office at CBC London, she's not that far away from the health unit and could go and get that dose of vaccine today if she was available. Let's go to the next question, and it is for Mayor Holder. Mayor Holder, this is from Nick Paparella at CTV and News Talk 1290 CJVK. Mayor Holder, what is the city planning in terms of some sort of memorial for the Afzal family now that flowers and keepsake items are being removed?
Hey, Nick, that's an important question. Thanks so much. Firstly, all of the keepsake items that are on site are being stored for the family at a future time. And all of the flowers that have been removed at this point, and there's been phenomenal and considerable support, huge support from the community. Our intention is to mulch those flowers and save those for potential use as the family sees fit. And as it relates specifically to the memorial, one of the things that most folks know is that London City Council passed a motion to honor this family by putting a memorial at that corner. And what's truly important to us right now is that we respect the sensitivity of the needs and direction of the Afzal family. So we respect them and we respect their circumstances and are at a point where we will await their direction. But it is absolutely our intention to proceed subject to their direction and their support of what we're looking to do. And as a community, we can do no less.
Thank you very much, Mayor Holder. Next question is from Jennifer Beeman at the London Free Press. Dr. Mackie, this one's for you. Dr. Mackie, how many people will each of these walk-in vaccination clinics be able to see?
The walk-in clinics really vary depending on the logistics of the setting. In general, they're anywhere from 200 to 500. It depends on the layout, staff availability. Vaccine doses aren't a major issue right now. We've got plenty available, but some of the logistics can constrain the flow of patients, and so that can reduce the capacity overall. They're, compared to the mass clinics where you're seeing 1,500 to 3,000 people per day, they aren't as high volume, but they're an important part of the picture for those that face any of those barriers to access.
Let's go to a follow-up question from Jennifer Beeman. Dr. Mackie, do we know how many Londoners 12 and up have received 2 doses of vaccine? How about those in the 18 and over crowd?
For sure. The 12 and up and 18 and over, we have the percentage. Yeah, so recommendations are really about avoiding indoor contact. In particular, we know that some jurisdictions outside of Canada aren't following the same sorts of protocols around indoor exposures. So, traveling itself isn't a tremendous risk if you're still going to follow appropriate precautions. At least if you look at the US, the rate of COVID there is comparable to what you're seeing here. There are some hot spots. The big difference is around the lack of public health measures in some places where masking and restrictions in terms of numbers of people are no longer in place. Around the world, you definitely have some hot spots in Africa, in South America, and in parts of Asia as well, where the rate of spread is much higher than here. But if you're looking at the US, the main issue is really, are you going to take part in some of those places or go into those environments where public health measures aren't in place anymore? And if so, then that becomes a big driver of risk.
Thanks very much, Dr. Mackie. And Sarah, thank you for the question. Great to have you joining us today, and I hope I didn't mess up your last name too much there. So yes, let's move to the next question. Dr. Mackie, question for you from Wendy Spence at the Dorchester Signpost. Dr. Mackie, can you please explain what people who wish to attend the pop-up clinic in Dorchester are supposed to do? I don't see any booking capability on the MLHU website. And is anyone who isn't getting their second shot, in other words, who got their first shot at the clinic in May in Dorchester, considered a walk-in?
Yeah, so this isn't primarily a walk-in clinic. It is a booked clinic, just as the first clinic was, the first 2 days there. Those were booked clinics as well. We didn't have walk-ins at the first Dorchester clinic either. Really what this is, it's a second dose clinic for those who got their first dose at the pop-up clinic in Dorchester the first 2 days that we were there. So it's not a walk-in. The appointments do need to be booked, and they essentially are already booked for second shots. There are lots of walk-in options available in other places over the next few weeks.
And a follow-up question, I think we might have a couple of follow-ups here from Wendy. Dr. Mackie, is Pfizer available since the clinic, as far as I know, is open to individuals who are 12 and over? Will it be available for everyone else?
Yeah, so Pfizer is available at that clinic. Again, it's a second dose clinic for folks that got their first doses at the first pop-up clinics in Dorchester.
All right, and the other question, I think we've answered through the other questions on that one. So let's move down. down. Next question is from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Mackie, how many COVID-19 cases are now associated with the outbreak at Christ Embassy Church?
Yeah, thanks for the question, Jackie. I'm just pulling that up. I don't believe we've had any more come in, but I want to confirm for you, okay? So as I look at the update from last night, it's still the same 6 cases at the Christ Embassy Church outbreak.
All right, thank you very much, Dr. Mackie. Let's move to a follow-up from Jacqueline LaBelle. Dr. Mackie, the province announced it is looking to involve more doctors in the vaccine rollout and provide public health units with more data as part of efforts to reach those who have not yet been vaccinated. How will this affect the MLHU and its approach?
So at this point, we are seeing strong uptake for the vaccine in primary care offices that are the family health team sort of integrated multidisciplinary offices. All of those primary care offices in this region have the ability to give vaccine and are onboarded into the COVAX. There is one exception out in Glendale, but other than that, the family health teams all have the ability to give the COVID vaccine. In single practitioner offices, independent family doc offices that don't have that team approach, it has proven more difficult. We've seen much lower uptake there. We're still, very much open to supporting those clinics to take up the vaccine, and it will be crucial long-term to make sure that we're able to get up to around 90% coverage to have primary care providers in the room and on the team. And we're very much looking forward to bringing more of them on board as they become willing and able to do so.
Thank you very much. Let's go to another question. Jacqueline has another. Dr. Mackie, the number of cases involving the Delta variant has been rising quickly this week. Is this in line with expectations?
Absolutely. What you're seeing is the same pattern that you've seen pretty much everywhere. The Delta variant outcompetes the other variants of COVID, and it quickly becomes the dominant strain. You're also seeing, because of the way the variants are classified, the screening tests previously weren't well able to capture the difference between Delta and the wild type, and you're seeing a better understanding of the dynamics. So the screening tests essentially have been adjusted, and we're able to identify more of the Delta variants more easily as well. So part of it is, improvements in the diagnostic technology. And in any case, I think we predicted this 3 or 4 weeks ago, Delta variant becoming the dominant strain, and that will likely continue going forward.
Thank you very much, Dr. Mackie. Jennifer Beeman from the London Free Press is joining us this afternoon. Dr. Mackie, are there any specific age groups that are lagging behind in vaccine uptake?
Yeah, and you saw a question about this earlier. It's really that 30 to 34 age group and the kind of the 5 years above and below, but particularly that age group. It's interesting. I mean, I think in younger folks, you see that the uptake has been good in part because so many people in the 18 to 24 group, for example, saw their friends become very sick and or were diagnosed themselves during the first 3 waves of the pandemic. And so you've seen good uptake in that group, and then it kind of drops off a little bit older than that. Again, we're concerned about the family issues. I mentioned we're working with partners that have connections with those age groups. It is difficult to think about how we would provide childcare in the mass clinic setting, but that may be an option for some of our pop-up clinics and on a smaller scale. Of course, getting out into neighborhoods, we believe, will help to reduce barriers for that group that have lots of time pressure as well.
Thank you very much, Dr. Mackie. And that does bring us to the end of the questions this afternoon. One of the things I do enjoy is we get a lot of the, we've had so many of these journalists joining us for months doing this, and having the conversations, whether we talk on the phone or we talk during these media briefings. But I did get a reminder from Carrie McKee that she has had both of her vaccine doses, so that's awesome. All right, thank you all so much for the questions, for the time. Mayor Holder, Dr. Mackie, as always, a pleasure to have you delivering that information to the community as we continue to address the challenges associated with the COVID-19 pandemic. That'll do it for this afternoon. We will be back with our next virtual media briefing. That is coming up on Monday afternoon at 2 o'clock. So between now and then, have a great rest of your Thursday afternoon. We'll see you on Monday, and so long for now.